Okay. Keep looking straight in my eye. Tell me what numbers you see.
It's your typical routine eye exam.
1.
Except in this case, both the patient and doctor are actually students.
Okay, good job. Switch over to the other side.
Students going through real-life scenarios of what they hope to someday be doing in the workforce.
So look straight in my light.
It's all part of Central Piedmont Community College's Ophthalmic Medical Personnel Program. The 1-year diploma or 2-year associate's degree program prepares students for a career in eye care.
Within the program, we are working with students to develop skills to assist ophthalmologists.
And that could mean anything from history taking and educating the patient to doing the actual vision test and assisting the physician in various procedures.
Our program is not very well known. Not a lot of people know about an ophthalmic career. A lot of people think that the assistants are nurses, so they think to go to a nursing path would get you any type of medical profession, but we are very specialized.
Hi, I'm Madison. I'm going to be taking care of you today. We're just going to be testing your vision.
First-year student Madison Merck goes through the various steps of what she hopes to soon be doing in the real world.
I never thought I'd be so interested in eyes and like learning different parts of the eyes and stuff like that. Like, you wouldn't think like that's something that you'd be super interested in until you're in the seat. Now, I just want you to tell me what fingers you see, okay?
For Madison, taking classes at Central Piedmont is bringing her full circle. She started her undergraduate courses at CP several years ago before moving on to East Carolina University.
I graduated in 2019.
With a degree in hospitality management, Madison went to work in the hotel industry.
I worked in the Sheraton Raleigh Hotel. I was a sales assistant. I basically did all the sales work, like the nitty-gritty graphs and putting in points for Marriott and stuff like that, learning about the hotel business.
But less than a year after starting her career, the pandemic hit. And like so many others, Madison found herself without a job.
So pandemic kind of killed the industry for me, and it was really hard for me to kind of pick up a job after that because like no one was hiring during that time.
After working some odd jobs to help pay the bills, she came back home to Charlotte.
My mom suggested, hey, why don't you look into CPCC again? See what type of programs are available.
So she did, and that search led her to the Ophthalmic Medical Personnel Program.
Alrighty, then can you cover your right eye for me and then read the lowest line you can see? I love talking to people. That's like my thing. I love interacting with others and just, you know, getting to know people and doing something that I'm like passionate about. I love taking care of people. So I'm just looking at her not covered eye right now.
When she completes the program, there's a good chance Madison and her classmates will find plenty of job opportunities. Like many careers in the healthcare world, openings for this position are growing quickly.
As far as demand is concerned, we are a field that is understaffed and is growing significantly. They expect anywhere from 8 to 10% continued increased growth over the next 10 years.
New employees entering the workforce make an average annual salary of over $36,000. The average for all workers across the United States is just over $50,000. In North Carolina, though, it's slightly less, at just under $48,000. But salaries can vary widely depending on education, certifications, additional skills, and the number of years in the profession. Some employees make over $60,000 annually.
And can you tell me what numbers you see?
12.
At Central Piedmont, students learn in the classroom through hands-on experience in the lab and assisting in the college's new public eye clinic. Lion Services, which had been offering free vision exams and glasses to those needing financial assistance, closed its doors in March after more than 25 years of service. Lion Services then donated all of its equipment and supplies to Central Piedmont, which is now continuing the free program.
These patients don't usually have access to eye care. In turn, that allows our students to work early with patients.
The patients that we see here are from all different walks of life. This morning we had a patient who had lost his glasses in a fire and hadn't seen in 5 years. Had another patient who has been homeless and a drifter for the past 15 years, who has been trying to wear over-the-counter readers which aren't working for his prescription. So when he got his glasses today during lunch, he started to cry.
Helping out in the community for those who need the care, while at the same time training the next generation of eye care professionals. For Carolina Impact, I'm Jason Terzis reporting.
Yeah, so it's nothing.
Thanks for watching, and if you don't want to miss any more great regional stories, please subscribe to our PBS Charlotte YouTube channel.